Welcome back. We are going to continue our conversation about primary care, and we're focusing today a lot on women's health and women of childbearing age and beyond for primary care. But really, your primary care doctor is your quarterback, no matter if you're a man or a woman. So I'm bringing back one of our primary care physicians, Dr. Kaitlyn Ladner. She is a family medicine specialist, and she's in our Madisonville clinic. So thank you so much for joining us today.
Thank you for having me.
Yeah. So we were talking with Dr. Ladner. We talked a lot about women's health, the focus on it, and we want to talk. We talked about childbearing years. Let's kind of shift the focus. Well, actually, first I'm remiss. Let's talk about you a little bit.
Okay.
Tell me a little personal tidbit about you so that our audience can get to know you.
Yeah, sure. So I was actually born and raised in this area. I grew up in Mandeville. I went to St. Scholastica for high school. So it's just been a pleasure to come back home. You know, I went to LSU for undergrad, and then I went to William Carey for med school, which is in Mississippi. Okay. And then I did my residency in Bogalusa, so not too far away, but still not home. So it was nice.
Right.
It's nice to come back, take care of the population I grew up in.
And how is that? I mean, you have to see a few familiar faces now and then.
I have, yeah. I've seen some people from high school. It's nice.
Yeah.
I like it, yeah. I like seeing familiar faces.
Do you see any people that knew you when you were a little girl? And they're like, oh my gosh.
I don't. I know a lot of people. I've seen a lot of people that know my mom and probably know who I was when I was a little girl.
Right.
But as far as like, yeah, and I don't think any from when I was a kid.
Yeah, so it's probably really helpful.
Though.
It's helpful to be in your own hometown and your community, right. And you're familiar with the lifestyle we lead in South Louisiana.
That's right.
Right, and so that's helpful. And like I kind of alluded to earlier, we focused a lot on the childbearing years, you know, for women and primary care and how important that is. So let's now shift gears and talk about as a woman goes throughout her life and in every stage of your life, right, why it's important to have your primary care physician.
So what I think is really awesome about primary care, and I guess specifically family medicine, is that we take care of people, you know, of all ages. So if I'm lucky enough to stay in Madisonville for the remainder of my career, I could have taken care of someone, you know, from when they were a child through their puberty, speaking of women, through their childbearing ages, into their menopause, possibly.
Right.
So it's just really awesome to take care of them throughout all the stages of their life.
And you kind of, I would imagine, and you can correct me if I'm wrong, when you establish a relationship with anybody, you're looking at their whole life's
absolutely
healthcare in a holistic kind of way.
Yeah.
So what does that look like, sort of?
So just, you know, from head to toe, making sure, you know, they're on the right medications for what they need, making sure they're having the right prevention screenings, making sure that they're doing all the lifestyle changes that they need to stay healthy. So yeah.
Yeah. So, and in women, I know a lot of things we talk about with women's health, and some things that maybe women don't pay attention to as much as maybe men, or maybe they do. But high blood pressure, that is always a risk, right?
Absolutely.
And heart disease. So those are two. Now we talk about women's health. We like to, you know, we like to hit home, educate, screen, prevent as far as breast cancer awareness and, you know, cervical cancer and things like that. But heart disease and high blood pressure are also contributing factors to women's health journey. So tell us about that. Like, where does that start with a woman?
So, I mean, from when they're kids, honestly, we start screening blood pressure. We take it at every well child visit, and then you know, into adulthood, we're checking their blood pressure at every visit to make sure that they're in the right range that they need to be. Cholesterol screening kind of starts a little bit later on. For women, if you have any cardiac risk factors, which could be obesity, smoking, alcohol use, any family history, which is pretty important around here.
Yeah.
We screen a little earlier, so around age 30, which is pretty pertinent for, you know, childbearing age. If you don't have any cardiac risk factors, we screen a little later around the age like 40. But we actually screen for cholesterol. That's what I'm talking about, cholesterol.
Yeah.
In kids as well. So between the ages of 9 and 11, and then again between the ages of 18 and 21. And then if you come see me as an adult, you aged out of pediatrics, for example. If you don't have those screenings done, then I would screen you for that at that point as well.
Okay, so I want to touch on two things. So blood pressure and it's important. You said we do it at every visit, and every visit I've ever been to, absolutely my blood pressure's been taken. What is the problem when you have blood pressure that's either too low or too high? How does it impact the rest of your health in your body.
Yeah, so if it's too high, it can eventually start causing issues with your arteries, leading to things like heart attacks, strokes. If it's too low, you can have issues like syncope, where you pass out. You're not perfusing your organs enough, so you can eventually have some organ damage. As far as high blood pressure, it can eventually cause kidney damage, can cause issues with your eyes. So a lot of different things that high blood pressure can cause.
And when we're talking about women specifically, I know that high blood pressure can be problematic in childbearing years. Yeah.
Right,
So how does that affect, your pregnancy?
Yeah. So it can lead to preeclampsia, which is a very severe issue during pregnancy, where you can eventually have seizures.
Wow.
You become eclamptic, and it would be a medical emergency and cause early. You'd have to deliver early. So yeah, it's definitely something that we take very seriously, especially in the childbearing age. If you are looking to get pregnant,
yeah,
we monitor that pretty closely.
So now let's go back to that cholesterol part, because you said you test in children as well. So that's kind of surprising to me. I didn't realize that.
Yeah,
and I have 4 children. I didn't even know.
Yeah.
So why do you do that in children?
It's just preventative.
Okay.
Yeah, so we're looking for early issues early on, especially, since childhood obesity is on the rise. It's important to keep an eye on these things. And a lot of cholesterol issues are familial. They run in your family.
Okay.
And so it's a good idea, especially if you're high risk, you have cardio risk factors in your family. We're going to take a closer look at things like that.
Okay. So you talked about when you look at someone's cardiac health, the whole picture, it's their lifestyle, it's their habits, it's their family history. For instance, my dad, I think he was in his 50s when he had his first heart attack.
So that puts you at high risk.
Exactly.
Absolutely.
So what would your advice be to someone who is at high risk? And that, I guess, speaks to the importance of establishing that relationship, right, with your primary care.
Yeah, so you have to find someone that you trust that can have these conversations with you, because they're not always easy. If you have someone that comes in that is obese, or that does smoke or drink alcohol, I know Dr. Ayler had touched on that a little bit, but it's important to get those risk factors down, because those do contribute a lot to high blood pressure. So helping people quit smoking is important, helping people lose weight, which can be a tough conversation to have with a lot of people. Making sure that they're staying active, any kind of cardiovascular, weight training, anything that they can do to keep moving is important for blood pressure. So yeah, just touching on those preventative things that they can do. Diet is really important. So something like a DASH diet, watching their salt intake, which is pretty difficult in the South, especially Southern Louisiana, where we love our food. So yeah, it's important to just monitor those things.
So would you say, and I guess how would you say, that part of your role as the primary care physician, as the quarterback, is how much of that role is counseling and coaching on how to stay healthy, how to maintain your health?
Yeah, I would say probably the majority of the time that I spend with patients is spent counseling. I really try to look for lifestyle modifications that they can participate in. I mean, if I have a patient that comes to me and their pressure is in that 120, 129 range, which is technically elevated blood pressure, it's not hypertensive.
Right.
You want to prevent them from getting to that next stage. So you really want to stress the importance of dietary changes and weight loss and stopping smoking, all the things that we just touched on, just to get them out of that danger zone that they're in.
So that's part of what you do.
Absolutely.
Yeah.
Yep.
So what is your kind of favorite age group? I think I've heard you talk about this before. Who's like your favorite age group?
Okay, well, my favorite age group is geriatrics. So I really enjoy the elderly population. Yeah, I thought about doing a geriatric fellowship, but then I got pregnant and my life carried on. But I do enjoy the geriatric population.
And what is it about the geriatric population that you enjoy?
I just like how they have no filter, honestly. They speak their mind. They're also pretty, I'm going to say difficult to care for, because you have to kind of walk this fine line between doing too much and not doing enough, if that makes sense.
Yeah.
You have a patient that's 80 years old that's on a high dose statin, like they don't need to be on that medication potentially. And so that's something that you can probably pull off. Or as you age, your blood pressure does get higher, but as you get older into your geriatric population, sometimes your blood pressure drops, and then you have to come off of some of those blood pressure medications. So they're just challenging.
Yeah,
but they're also fun.
Challenge and balance. Yeah. So if I come to you as a patient, if anybody comes to you as a patient, and you find something along the journey that requires a specialist intervention, talk about how that occurs. What happens from your kind of perspective?
Okay, so for example, I had a 40-year-old that came to me who hadn't seen a doctor in 20 years, who was having headaches and had really high blood pressure. So he ended up being in kidney failure.
Wow.
Yeah, from this long-standing hypertension issue that he had.
Thank goodness he came in.
Yeah, so I had to coordinate care, with the renal team, making sure that he got where he needed to be, and of course they coordinated with like renal transplant teams, and now he's on the transplant list. But it's about getting him set up with a cardiologist to make sure that his blood pressure is much more controlled than it was.
Yes.
That's someone that it's out of my scope, and he needs the care, the extra care, and it's great that we have an awesome cardiology team to help manage these more difficult patients with uncontrolled hypertension and potentially uncontrolled cholesterol.
And you touched on something. The health system as a whole, you have a lot of support to rely on and relationships. And so that's an important part of primary care at St. Tammany Health System in particular. So I think the specialist part is very important because I don't know if people understand that you are there to lay the baseline for health care, issue spot, counsel, but if there's something that is, like you said, kind of beyond your scope, you have the resources to pull someone else in and get them better.
Yeah.
So
and what's nice is that we have a close communication with all of our specialists, so we're able to personally call and see if I have someone that really needs to get in, I'm able to get them in when they need to be seen.
Okay. Well, is there anything else you want to add at all about the relationship with your primary care doctor, whether you're a woman of childbearing age, woman beyond childbearing age years, or a man in the community?
I would just say it's important to find someone that you trust. I think that's a big part of finding the provider that's right for you. I hope that I create like the environment that a patient would want to come in and have a conversation with me and tell me everything that's going on so that I can better treat them.
Yeah, because like Dr. Alaire, I mean, you're not there to judge the person, right?
Absolutely not.
You're there to like help them make their lives better.
Right.
Yeah, so that's good to know. So you're not a judgmental doctor.
No. Definitely not. I do also want to say that medications are important for blood pressure, especially in, women don't think about birth control itself. If they're on a form of birth control that's higher in estrogen, it can cause issues with high blood pressure. So ibuprofen, that's something that can cause elevated blood pressure if they're taking it enough. Like women who have premenstrual cramping, things like that, they're taking pretty regular ibuprofen to help get through those periods.
Okay, that's interesting to know.
That's important.
Yeah. Okay, well, thank you so much for being here, Dr. Ladner.
It's fun.
I appreciate you coming in and talking with us about this important topic. And thank you for joining us on Healthy Living. We will see you next time.